What we have to very closely track is what's happening with the COVID-19 cases in India. Should you be worried, or is it just about how the cases are expected to fluctuate in season and as we near the month of April? Well, India has recorded highest daily COVID cases since November, as 841 cases are reported in last 24 hours. 2 people have died. Kerala, Maharashtra, Karnataka, Gujarat are the states reporting the highest numbers as of now. I'm being joined by my colleague Priyanshi to put all of this in perspective. Priyanshi, what are health officials telling in terms of this numbers? There are 2 deaths reported yesterday. It's of course lower than the 5 deaths, but deaths being reported now and cases crossing 800 mark, highest since November.
That's right, Sneha. And in fact, we've spoken to health officials as well who say that though the cases are rising, there's nothing to panic about just yet. And they're saying it's important to keep a strong vigil there and be alert. But they're saying that hospital admissions are not increasing. More and more people are not coming up with COVID symptoms to hospitals. So the sense that we're getting right now is that the increase in cases are still mild. And as we know that it's the influenza season that's also ongoing. So there are symptoms that are similar to that as well. But of course, it's important to note here that cases have gone up. It's around 841, which is the highest cases since November 11, the highest in over 4 months. And let's also put this in perspective to show you sort of a trend from the last few weeks. Now, the average of the daily cases that's being reported in the country currently is around 626. This is the average of the last 7 days. Now, this is for 6 times higher in the last 1 month. On February 18th, the average of the daily COVID cases was 112, but now that has jumped 6 times and it's now 626. So that just shows you how rapidly the cases are increasing, and slowly and steadily the cases sure are increasing, which remind all of us to put up our masks as well. If we talk about active cases, the active cases in the country are also increasing day by day, and they've in fact doubled and tripled over the last 1 month or so. So that trend is concerning, but it's not creating any panic just yet. And we, as you mentioned, that the total deaths reported were around 2 in the last 24 hours, which is lower than the 5 deaths that were reported yesterday. If we also talk about the tests, there are over 1 lakh tests being conducted every single day on an average. And let me also point out to the testing trend here, that we've seen that 2 weeks ago also over 1 lakh tests were being conducted, and 4 weeks ago as well over 1 lakh tests were being conducted. So this rise in cases cannot be attributed to the rise in tests. Tests are pretty much the same over the last 4-5 weeks. So the rise in cases is definitely because the positivity rate, of course, is also rising. It's around 0.8% now in the country at large, but it is higher in several districts, as you pointed out, and it's the highest in Kerala, Maharashtra, Karnataka, and Gujarat.
Right. Thank you, Priyanshi, for those details. I'm being joined at this point by Dr. Ishwar Gilada. He's the consultant for infectious diseases and the Secretary General of Organized Medicine Academic Guild, OMAG, and also being joined by Dr. D.K. Gupta. He is a specialist with the Felix Hospital. Thank you, both of you, for joining us. First to you, Dr. Ishwar Gilada. How are you looking at this positivity rate on the rise, numbers on the rise? Is it time to mask up yet?
Okay. Now, first thing first, thank you very much for having me on the show. We should have expected this long back.
Okay.
This is bound to happen because of the waning immunity, whether to natural infection or to vaccination. If you consider second dose of vaccine to be taken, it was almost 1.5 to 2 years back. If third dose is considered, more than 1 year back. And there are a lot of people who have not taken third dose, particularly even those which are vulnerable, about 60, with comorbidities, having respiratory problem, kidney problem, diabetes, uncontrolled diabetes.
But so in terms of percentage of population, Dr. Gilada, if I'm not wrong, that's not a very significantly large number.
I'm coming to that. The second issue is there is a lot of targeted testing. Okay, a total test may be 1 lakh per day. But because currently for last 2 weeks, 3 weeks or 4 weeks, there are a lot of cases of respiratory illnesses coming up. They can be because of the pollution, they can be because of allergens, they can be because of H1N1 and H3N2, RSV virus, adenovirus, and COVID.
Right.
When patient come to us, to doctors, doctor can offer only COVID test because that is cheaper and easily available. H1N1 test or influenza test is very expensive.
Right.
It is not available in government at all, only in private sector, and that to 5,500 rupees per test. How many people can afford that? So what happens is when patient come with any kind of symptom, COVID will be diagnosed, other cases will not be diagnosed. So if COVID is negative, it doesn't mean that the person doesn't have flu because flu test is not done. And within some time, patient recovers. We should not be worried about such trend. We should keep a close watch. We should keep genome sequencing to be done. We should ask those people to have a reverse masking. If you have a cough, mask it. The respiratory viruses are going to go out or come in only from mouth and nose. They will not come out from go out from anywhere else. So those who are having even little cough, mask it and protect those people which are at home, because the conduit between society and the people at home which are with comorbidity or ill people, they are the young people, young children going to school, young people going for work. So they are the people who could be conduit. They may not suffer. They may just carry virus and provide virus or inoculum to their elderly people. So under this situation, we should keep watch. And it is currently TT, KK, M and G. TT is Tamil Nadu and Telangana. KK is Kerala and Karnataka. And M and Maharashtra and G and Gujarat. Nowhere else currently that kind of scene is there. But this scene is because of mainly, I would believe, is a targeted testing more than a real surge in COVID cases.
Right. Dr. D.K. Gupta, Mr. Gilada has made an important point, and that is when patients are coming for, with whatever symptoms they are coming, the test that is being done on them is the COVID test because, one, the accessibility, the rate and all of those details that he's given out. But would this mean that those who are coming in with these symptoms could be patients who are having, say, influenza and other illnesses that Dr. Gilada mentioned? But would that also mean that they would test positive for COVID? Dr. D.K. Gupta? Dr. D.K. Gupta, you have to unmute yourself. We can't hear you, Dr. D.K. Gupta. You'll have to unmute yourself from there. All right. There seems to be some audio issue with D.K. Gupta, and we'll come back to him. But back to you, Dr. Gilada, at this point. What I asked is the same question back to you in terms of, so you made an important point. This is also a season which is seeing a lot of influenza cases, even specific influenza cases for that matter. Virus is spreading. So people who are coming to your hospital or to places with symptoms are getting tested positive for COVID. Is there also an interlinkage that if they may be having that but will also test positive for COVID-19? Could you clarify that for us?
Yeah, there could be possibility of dual infection, flu plus COVID. And there could be only COVID and there could be only flu. But as I said, flu test being very expensive, first test we do is COVID. And if COVID is positive, we consider COVID. But it doesn't mean that the person doesn't have flu or dual infection. So what we are going to see currently in at least 1 month or so is a dual pandemic or dual epidemic. On one side, the flu is going on the other side, COVID is going on. Among the flu, H3N2 is more common currently than H1N1. And other flu viruses like influenza B is weak. It is not going to hamper much. But if we had a vaccine which is affordable and accessible, I think we could have prevented flu in a very big way. There is a lot of dichotomy. COVID vaccine is available only in government setup. It is not available in private. It has been not privatized. But flu vaccine is available only in private. It is not in government because it's expensive. I think when we had a COVID mania or COVID-centric policies, we should have looked into what can happen with flu. We could have energized our local industry to make flu vaccines available, affordable and accessible, and they can do that. But we did not do that. We only talked about COVID. Now also, if we talk about COVID, don't go by 1 day, 2 dates and 5 dates. Go by a weekly date. Go by weekly requirement of oxygen. Currently, H3N2 people require more oxygen than COVID. So go by that oxygen parameter, bed parameter, ICU parameter, ventilator. I think we should not create panic at all. People are not going to listen anything to mask mandate. Mask can be requested but cannot be mandated at this time.
Okay.
And that's the reason that we should have rational policy. We should actually currently dismantle all COVID committees. A lot of people sitting on the COVID committees, they do not know ground reality. They are sitting in ivory towers and they talk
Okay,
something.
I'll come back to you, Mr.
Hamper our
Gilada.
people.
I'll come
Yeah.
back to you. Let me get in Dr. D.K. Gupta at this point. Dr. D.K. Gupta, what should people do at this point? There have been almost 2 to 3 years that people have literally battled pandemic. Livelihoods have been affected. At this point, what's the message you want to give out to people who are listening to you? What should they do?
I think this is a great question, and I would like to tell you that we should not do panic at all in the community. There are 3 diseases among right now. One is all they are known as ILI, it means influenza-like illnesses. One is COVID, second is H1N1, and third is H3N2. And all these 3 diseases, their mode of respiratory is same. They are transmitted by the droplet infection during coughing, sneezing. Therefore, the prevention method is all same for all these 3. And we have following this for last 3 years. We have practiced it for 3 years for COVID also. So similar things can be done, like masking. We can do frequent hand washing. Do not touch your nose, eyes, and mouth with your fingers. And if to avoid going to crowded area, do isolation if you are having symptoms of illness. And second thing, most important, all the 3 diseases are vaccine preventable disease. We have COVID vaccine. We have influenza-like vaccine for both the strains. Therefore, these diseases can be prevented with the vaccine also. One thing I want to make it important here, that is like booster doses, the penetration is quite low among our community. We are having only 27 to 30% booster doses given to the Indian population. Around 220 crore vaccine has been given. Out of this, only 27 to 30% is booster doses. Therefore, and we all know that vaccine immunity and natural immunity can be weaned off after 6 to 9 months, and it has been more than 1.5 to 2 years for the most of the population, and immunity has been weaned off. We can do the antibody titers also. So therefore, I would request that everybody who is eligible for booster dose get earliest their booster shot for COVID vaccine, and high risk population, that is children less than 5 years or people more than 60 or 65 years having COPD, asthma, heart patients, kidney transplant patients, dialysis, they should get boosters, but they should get shot for flu also, so that the flu should not be serious among these population also. Otherwise, 97 to 98% in all the 3 diseases, they are self-limited disease without any complication, without any sequelae, without any death. So I think we should not get panic. Only message is that we should focus on the prevention. Prevention is better than cure. Second point is early diagnosis and early treatment. If somebody is having any dangerous sign, like they are having chest pain, breathing difficulty, shortness of breath, or severe weakness, convulsions, seizures, or SpO2 falling less than 90 to 93%, and definitely they should immediately contact nearby hospital or nearby emergency department or nearby doctor, so that they can need early diagnosis. We have to do then testing for all these 3, because we cannot clinically rule out any disease based on clinical sign and symptom, because all symptoms are same in all these 3 diseases. Therefore, we have to do some tests all in these cases, serious cases, and after that, early diagnosis can be made, and effective and effective treatment can be given.
All right.
Yeah.
Thank you, Dr. Gilada. Now, if you're saying prevention is important, it's better than cure. In this context that we're talking, specifically with the vulnerable section, with, say, infants or small children, what are the preventions practically possible in this case? Because obviously mingling is going to happen. There are no restrictions. There can't be restrictions. People will be going out. There are, there are mass meetings. There are family gatherings. There are play times. All of these things are happening. So what prevention really are we talking about?
See, there are 2 ways of prevention. One is a biological prevention, and that is through vaccine. So those who have not taken the 3rd or the preventive dose, they must take. There are lots of doses wasted and they expire. Number 2 is the behavioral prevention. Whenever you are going in the crowded places, in buses, in trains, in theaters, in cinema halls, you use mask. And when you come back, and if you do develop any, because fever is only for 3 to 5 days, your cough is happening for 2 to 3 weeks. When they prolong cough, it is H3N2 more commonly. But when this cough is going on for at least even 1 day, you should start masking immediately. Don't wait to see whether it is a common flu or ILR-like syndrome or a COVID. And if you are having relatives which are at home, which are elderly, which are with comorbidities, protect them. And if you don't want to protect them, at least ask them to use mask. You want to hug them, okay, let them be putting mask. So active and proactive masking by those people which are at higher risk, and reverse masking for those people which are more risk or less risk when they get cough.
Okay. Dr. D.K. Gupta, we just have time for one more question. When we're talking about the preventions that we are talking, and you're saying early symptoms that come in, go and get yourself checked. The message that you're trying to give people at this point is don't stay home if you're developing any symptoms.
No, the message is very clear that if you are having symptoms, like symptoms like cough, sore throat, body ache, pain, myalgia, headache, or fever, sometimes nausea, vomiting, and in few cases can be diarrhea also. They are all ILI-like symptoms. You should isolate first. Don't do our test first. You should isolate first. And if you are having serious symptoms, then definitely you have to go for testing also to the nearby center.
Doctor, sorry to interject you. Let me just ask you one question. Why then, if this is about targeting testing and that's why cases are high, why are specific states like say Maharashtra, Kerala, Karnataka reporting the highest numbers? Why aren't similar cases being reported in other states as well?
It depends on the positivity rate, and the guidelines issued according to the positivity rate of that states, and depending on the past experience.
Can you break that down for the common man? That language is a little difficult to understand.
I mean, it depends upon the how many positive cases or what is the stage of the disease in the community in that state.
Okay. All right. Thank you, doctors, for joining us. A very important discussion, and I hope our viewers have benefited from this. I think very important, as the doctors have mentioned, if you have any symptoms, please mask up.